Okay, good afternoon and good evening to whichever part of the world you are in. Thank you for the opportunity to share my thoughts on the vaccination perspectives in this part of the world. So this has been very difficult times for all of us, and I think we have to retain our sense of humor, and this cartoon very nicely illustrates what has been happening in India. You would have read about the Kumbh Mela and all the other gatherings going on, and recently there was a ruling in the Delhi High Court where if you were traveling alone in your car, you still had to wear your mask. And this was a little bit of a surprise to a lot of us. If you look at the situation in India, you find that there have been almost 16.6 million cases. This is from data just a few days back, and about a death of close to about 200,000. Now, if you look at the deaths world over for a population which is similar to what we have in India, about 1.3 billion, the deaths have been close to 2 million. So I would say India has done reasonably well, but unfortunately we are in the middle of the second wave, and about a week ago we recorded the highest number of cases in one day for any country, over 316,000 patients for one day. Now let us come back to the question of vaccination. So if you look at the new cases, it has been tremendously increasing. You'll see the second wave is really picking up there. And if you compare the vaccinations which have been done in India, you will find that over 116,000 people have been, sorry, it's about 11 million people have been vaccinated. It's actually more than 35. It's about 116 million have been vaccinated, which actually means a population of about 8.6%, and fully vaccinated, those who have received 2 doses, is just a mere 1.6%. When you compare this with the rest of the world, Israel has vaccinated almost 62% of its population, the UK close to 50%, the US about 40%, and India is probably in the region of 8% of the population who have received just 1 dose, and less than 2% of the population who have received both doses. In India, the government of India started the vaccine rollout on the 16th of January. Initially, when the phase of limited vaccine availability was there, this was launched as stage 1, where only healthcare workers who were at a high risk of getting the disease were vaccinated. This progressively went on to those people. Actually, it says over the age of 65, but subsequently people over the age of 45 started their vaccination. This was sometime on the 1st of April. People over the age of 45, irrespective of comorbidities, were also added to this. And it is believed that by the 1st of May, within the next week, the vaccines will be opened out for all population above the age of 18. There have been a lot of queries whether India would be able to have enough vaccines to support this initiative, but we have to wait and see how this progresses. The vaccines are all currently routed through the government sources. It is only government which gives the vaccine to all vaccine centers. When it started, it was only for the government colleges, hospitals, and other centers, but subsequently they opened it out for private players also. And the only issue is you need to go through the CoWIN app, which has been introduced, and you need to have at least 1 or 2 photo identity cards for everybody to be vaccinated. Priority should be given for those who have not had the COVID infection and who had other comorbidities. If you look at the consumption of COVID-19 vaccines since the 16th of Jan, it has varied significantly between the various states of India. You'll see the dark states. This is Maharashtra, which bore the brunt of the second wave and also probably the first wave. Delhi is somewhere in this region. There have been a lot of challenges. In India, there are 2 vaccines which have been approved. One is the Covishield from AstraZeneca. The other is the Covaxin, which is manufactured by Bharat Biotech. Covishield, through support of AstraZeneca, is manufactured by the Serum Institute in India. There have been problems of supply. Initially, and even now, the Serum Institute manufactures about 2.4 million doses a day, which works out about 60 to 65 million doses a month. Bharat Biotech is barely able to produce about 10 million doses a month. So we are looking at about 75 million doses at present supply per month for a population of about 1.3 billion. So this has been a phenomenal challenge. The presence of two vaccines with varying intervals, the Covaxin, for which the interval is 28 days, versus the AstraZeneca, which initially started with 4 weeks and now has been progressively increased to 12 weeks, has made it difficult as part of a vaccination program. And right now, the government has said that the Covishield can be had, the second dose can be had anywhere between 4 to 8 weeks. After the initial investment, unfortunately, the government has had trouble investing into the vaccine production, even though there are several private players which have started up and are ramping up production. The issues of vaccine side effects, especially related to the Covishield and the occurrence of the vaccine-induced thrombosis and immune thrombocytopenia, has been a big dent. Several European countries closing down Covishield affected the uptake of vaccine of Covishield in India also. Another aspect has been the variants of concern. Whether the current Covishield vaccine, especially again after the South African variant was detected and the South African country blocked the sale of Covishield in their country, whether if variants similar to the South African variant can occur, will the vaccine be effective? We have recently detected the double mutant in Mumbai and Maharashtra, and probably something referred to as the triple mutant in Kolkata. And people are worried whether this will make vaccines protective. There is also the issue of the behavioral cognitive biases, where the optimism bias, when one feels that bad things may not happen to one, or the action or the omission bias, where people feel more comfortable not doing something, whereas doing something and incurring problems with the activity. So this cartoon very nicely shows the confusion existing between Covishield and Covaxin in India, and people are quite thoroughly confused which would be a better vaccine. There has been a lot of disparity between various states of India. You will see that the uptake of vaccines or the vaccines available has varied between different states, and this is not dependent on the population alone. There is a lot of vaccine hesitancy. There is definitely a shortage of vaccines, but the official news is there is no vaccine shortage, and this confusion causes a lot of problems between the providers and the people who are demanding for vaccines, even though there is significant vaccine hesitancy. It is believed that from the 1st of May, anybody over the age of 18 will be able to get jabs through private facilities, and we are looking forward to it, but still there is a lot of question about availability of vaccines. But more importantly, what has been a huge problem for medical personnel or the people who are administering the vaccines has been what you see in this cartoon. When initially the vaccines were started, probably about over 6-7 months ago, everybody wanted the vaccine as soon as possible. But when the vaccine was released in January, there was a lot of question whether you could trust the vaccine. People start raising questions. And the issue of infodemic, or the information pandemic, which went viral through the social media on various aspects of the vaccine harm or the poor effectiveness, or the way in which the big pharma companies were capitalizing on making money at the expense of the public, became a huge issue. And this has still been plaguing India, to the effect that one cartoon which has come out recently is, I found it very apt to say that people are worried about the minimal side effect of vaccine and forget the massive benefits which the vaccine provides to the entire community. Recently, another problem which we have been having is the question of post-vaccination breakthrough infection. The vaccine drive was started by late January, and when the vaccine drive was just picking up, the second wave hit in sometime by early February. And as this table shows, you'll find that those who have received the first vaccines, a significant number, though not in percentage, but in numbers, developed the infection. With Covishield, more than 100 million doses, almost 17,145 people developed side effects. In percentage, this appears small, but when this is blown up in the media, this can be a quite difficult fact to digest. People were worried whether the vaccines were making them sick with COVID. These are data from the Indian Council of Medical Research. I'm not very sure of the authenticity, but this is what they've collected so far. So this has also dampened the uptake of vaccines in India. The recent paper which came about on the evidence of increased breakthrough due to variants of concern has always plagued people's minds. Also, the fact that the postulate that facilitating antibodies can lead to a shorter incubation period and the rapid occurrence of COVID after a vaccine is taken has also been debated among various medical personnel. We still don't know the answers, but this is again a point of interest. At the same time, we have had several opportunities. Recently, the government has opened up to increasing the funding for vaccine production and ramping up supply. It is believed that by July or August, from 65 million, the Serum Institute will manufacture about 100 million doses of Covishield per month. Bharat Biotech will step up their production to almost 60 to 80 million doses of Covaxin per month. It is believed that the fast-track approval for several vaccines, including Sputnik, and also Pfizer and Moderna, which is in the pipeline, will definitely help ease the vaccine crunch. ICMR is collaborating with various agencies and trying to push this same agenda through. We are also having gene sequencing studies done, collecting the recent samples on surveillance trials to see whether the newer variants would be susceptible to the vaccine risk protection. And also this time has been very, very attractive for technology transfer between the government and the private agencies and the pharma companies to help probably pool in resources and get a good result in the bargain. This again came up a couple of days ago on the vaccine doses in the pipeline. You will see that as far as the number of vaccines procured per inhabitant is highest in Canada, somewhere in the region of 8.67, and in India is probably in the region of 1.15. But you have to understand that the Indian population of 1.3 billion, only about 6% are over the age of 60. So it's a predominantly young population who are healthy, and the chances of having serious infections is very, very small. It is also came up recently, though we don't have official information from the Ministry of Health and Family Welfare. This is yesterday's newspaper, that more vaccination hubs will be introduced so that it will be able to cover a larger section of the population. It is also very interesting and gratifying to note that the Covaxin shots have shown close to 80% interim efficacy and 100% in severe cases, and it is probably effective against the variants of concern also. But lastly, I think what we need to probably be a little more proactive in India is the responsibility of the media. And I'm just showing one TV screenshot which said that beware of the second wave, all 37 positive COVID doctors were vaccinated. You know, this is a way of putting it, but the inquiry which looked into that is the vaccines were still over 90% protective. 99% of the people who suffered were protected from hospitalization, and almost all of them did not have severe disease. So the media sometimes plays up in a manner that is very dramatic, but unfortunately not helpful to the government or the country in their effort against vaccines. So lastly, the way forwards. This is a Lancet COVID-19 commission in India, the task force, which has come up with various suggestions just a couple of weeks ago. They have suggested a target of about 5 million people to be vaccinated per day, deploy a broader mix of vaccines, ramp up the manufacturing, put in measures to address vaccine hesitancy by giving stories and good news, because always information and evidence may not be able to address this hesitancy, monitor, collate, and transparently report the adverse events following immunization, concentrate more on non-pharmacological initiatives, including masking, social gathering, limitation, testing and surveillance, limitation of travel, defer opening of schools and colleges, genome sequencing, and most importantly, strengthening the health system. Unfortunately, in India, with a population of 1.3 billion people, social distancing will never work. You can see this is again humorously representing what Indians are used to. So I think the vaccination is the only way forward. And we have to look at ways and means to ensure that the vaccine hesitancy is overcome and we are able to provide enough vaccines to supply the large population. Thank you.
Thanks very much, Ram. Really comprehensive presentation, and I can see from the chat box that there are a lot of questions, and perhaps maybe we'll come back, but I will start by asking you, which came across both in Professor Wagid Anwar and yours, about the hesitancy, vaccine hesitancy and strategy adopted in Egypt. Almost 30–50% of people are, not sure about the vaccine. Similar, probably more in India. What is the strategy at your end? Governmental, NGO, local leaders to overcome the hesitancy?
the Prime Minister gave a talk to the entire nation about 3 or 4 days ago, in which he stressed the importance of vaccines. People are very worried about the side effects, and they fail to realize that the benefits of vaccines to the community at large overcomes any small deficiency of side effects. But this has to be stressed forward. As I said, the adverse events following immunization is being seriously collected so that we can be transparent about the vaccine side effects. People are looking at, as I said, the recent breakthrough in infections and seeing whether this has any connection with either the vaccine or vaccine can induce the facilitating antibodies. So we need probably more collection of data and transparency, which I think the government is taking up now, and hopefully it should succeed.
Thank you. Tonya?
Thank you very much for a really interesting talk. I think you touched on a really important point that, you know, at this point when there's rapidly rising infection, that vaccination is, you know, one of your key roads out of this. I guess, you know, what are the key barriers apart from vaccine hesitancy? I understand, you know, in terms of access to vaccines, there are issues with obtaining the raw materials to produce vaccines, and that it may be impacted by export bans from the US. You also touched on the fact that Pfizer and Moderna vaccines may come on board in India. Do you think, you know, given the delivery requirement, refrigeration requirement for those two vaccines, are they realistic to roll these vaccines out?
No, my personal opinion is that Pfizer and Moderna, getting them implemented in India will be a phenomenal challenge because of the adverse weather conditions. We are running at temperatures of 40 degrees now in Chennai, and maintaining a cold chain will be a nightmare in most parts of India in summer. So I don't believe, you know, they will be a big hit, but the Gamaleya vaccine, the Sputnik vaccine, and the other DNA vaccines probably, which are at the pipeline where you can store them at room temperature, sound very attractive. The problem of, you know, the advantage of getting more vaccines into the system will be compounded by problems of ensuring, you know, choices for people. So the Covishield now looks like we should avoid it for younger people, pregnant and lactating women who may be young. And Covaxin is in short supply. I think the Sputnik vaccine, which is likely to be introduced soon, seems very attractive.
Thank you. So, you know, you said something which we're all aware about, the power of the youth and the young in India in terms of driving the economy and the risks of it. But 1.3 billion, and the elderly and the comorbid conditions is obviously what predisposed to higher complication and mortality. How do you get that message that that you need to prioritize, or how do you prioritize in India the vaccination program when you have a predominantly young population?
I think we need, you know, leaders. We need people who are the faces who can attract people, whether they are film personalities, whether they are sports celebrities, or whether they're politicians. We need more people who will come forward and encourage the youth to take up the vaccine. They have started it, but I think we have a long way to go because unfortunately, right now with the crisis happening and of course, some short supply in the vaccines, it is going to be quite a big challenge.